antibiotic is a chemical that kills microbes, or the little bugs like bacteria and viruses and the amoebas. So let's take, for example, some of the pneumonias or inflamed lungs. That's caused by the bacteria pneumococcus. That is killed by an antibiotic called amoxicillin. If you take one of the sexually transmitted diseases like chlamydia, that causes, pus and pain in your dick if you get it. Well, chlamydia is killed by the tetracyclines. So these chemicals are very important in our life to control these infections. Now, not every microbe that causes an infection has an antibiotic that would kill it. Like, for example, big in the news these days is Ebola virus. Now, unfortunately, if you get an Ebola virus infection, there is just no treatment. Now, antibiotics that we use as doctors have really only been around for 60, maybe 70 years. Now, we're using a lot of them. And as time goes on, these crafty little microbes are becoming resistant to them. And this is leading to the concept of superbugs. So these superbugs then are microbes that infect you in some way, whether it's in your tummy or chest or in your heart, and none of these antibiotics will kill them. So really, if we don't sort this out, we're in the shit. So how do we prevent infection in an environment where superbugs are developing? Well, firstly, as an individual, what you can do is stay fit and healthy. So that means if you get an infection, there's less chance of it beating you. Whereas if you're unhealthy, then your immunity has less ability to fight. Secondly, bugs like grubby places and they like dark places. So what I'm saying is keep your house and where you live well aerated with lots of sunlight, because sunlight kills bacteria, and make sure it's clean. There's not a lot of dark places with grubby stuff, and that stops the bugs collecting. Thirdly, if you do get an infection and your doctor prescribes you antibiotics, make sure you finish the full course. And that will ensure that that infection is, knocked off properly. Don't have just half a course. And don't use antibiotics unless they're prescribed by your health professional, your doctor, practice nurse, or midwife. Don't go and get stuff off other people, because invariably it's the wrong antibiotic for the wrong infection. Fourthly, get natural immunity. And natural immunity is by vaccinating yourself. Like you take, for example, pneumococcus that causes pneumonias. Well, they're actually vaccines that prevent that bug taking over your system. So vaccination is very important. From my point of view as a health professional, like all my doctor and midwife and nurse mates, we have got to prescribe responsibly. Like if someone turns up in our surgery with a cold and it's obviously a virus, you don't want to give them strong antibiotics which kill bacteria, and the cold's going to get right by itself. So we have to be careful. From the government's point of view, it's got to invest money in developing new antibiotics to stay smart and ahead of these bugs. Because with time, these bacteria and viruses who get resistant will get smarter and smarter. So we've got to keep ahead of them. So that's antibiotics and superbugs, fellas.